There is a muscle in your lower leg right now that you have almost certainly never thought about. You cannot see it in the mirror. You cannot feel it working on its own. It produces no visible definition, and it gets no attention at the gym. It sits deep behind your shin bone, tucked beneath the larger calf muscle, silent and largely ignored by everyone who has ever given you advice about blood sugar, metabolism, or energy. And a peer-reviewed study published in the journal iScience found that activating this one muscle while sitting completely still, not walking, not exercising, sitting in a chair, cut the post-meal blood sugar spike by approximately 50% and reduced insulin release by nearly 60%. When I encountered that research, it reframed something I had been observing in patients for years without fully understanding the mechanism producing it. My name is Dr. Kenji Sato. I am a preventive medicine physician and longevity researcher. And the post-meal blood sugar cycle, the fatigue, the cravings, the afternoon fog that millions of people experience daily and attribute to aging or to having eaten too much is one of the most consistently misunderstood metabolic patterns I encounter in clinical practice. Not because the science is unclear, because the explanation most people receive is incomplete in ways that leave them managing symptoms rather than understanding and addressing the process producing those symptoms. Before we continue, one clinical note. Everything I am describing today addresses the biological mechanisms driving post-meal blood sugar dysregulation and what their research shows about interrupting those mechanisms through movement. If you are currently on blood sugar medications or insulin, nothing in this discussion should be used to modify, reduce, or stop those medications without direct supervision from your managing physician. Bring this information to your next appointment. Have the conversation with the physician who knows your complete health picture. The information here is designed to complement clinical care, not to replace it. Now, what is actually happening in your body after every meal, and why the picture most people have been given is incomplete in ways that matter? Glucose is not the problem. I want to establish this clearly at the beginning because the popular conversation around blood sugar has created a widespread impression that glucose itself is the enemy, something to be minimized, avoided, and feared. That impression is incorrect. And the incorrectness matters because it leads people toward the wrong interventions. Glucose is fuel. Every cell in your body depends on it. Your muscles burn it for movement. Your liver stores it as glycogen for emergency energy demands. Your brain, and this is the part that explains the afternoon experience millions of people have and misattribute, depends on glucose almost exclusively for its energy supply. There's no meaningful alternative fuel pathway for the brain, the way there is for muscle tissue. Cut the brain's glucose supply for even a few minutes, and cognitive function degrades rapidly. Thinking slows. Focus disappears. Decision M becomes unreliable. Glucose is not optional. It is a non-negotiable biological requirement for staying alive and thinking clearly. The problem is never glucose itself. The problem is what happens when too much of it arrives in the bloodstream too quickly and your body has no immediate productive use for it. When you eat carbohydrates, your digestive system breaks them down into glucose and releases that glucose into the bloodstream. This is normal and necessary. The difficulty begins when a large quantity of glucose arrives rapidly. Your blood vessels experience what might be described as a pressure surge, and your body detects it immediately. The signal goes to the pancreas, which releases a hormone called insulin. Insulin functions as a delivery mechanism. It moves glucose from the bloodstream into cells where it can be used as fuel or stored for later use. Some goes to muscle cells for immediate energy. A significant portion goes to the liver where it is stored as glycogen. But here is where the sequence begins to break down for most people living in the conditions of modern sedentary life. If your muscles are not contracting after the meal, they are not burning fuel. They have no immediate demand for the glucose arriving in the bloodstream. If your liver is already adequately stocked with glycogen from previous meals, it cannot accept more. The glucose has very limited productive destinations available to it. Your body cannot leave excess glucose circulating in the bloodstream. The damage that sustained high blood glucose produces to vessel walls, to kidney tissue, to thalans of the eye is well documented and significant. So the body does the only remaining thing available to it. It converts that glucose to fat and stores it. Meanwhile, the insulin released to manage the surge has done its job sometimes too efficiently. Blood sugar drops, and in many people it drops below the level it was at before the meal. This is the crash, and this is where the cascade of symptoms that is so familiar to so many people originates. Your blood sugar falls quickly. Your brain, which has no meaningful fuel storage of its own and depends on continuous glucose delivery, detects the drop immediately and triggers what is essentially an alarm response. Fuel is running low. Correct this now. A wave of fatigue arrives. Thinking becomes slow and effortful. Focus disappears, and then comes the craving, specific and urgent, for something sweet or starchy, something that will push blood sugar back up quickly. This is not weakness. It is not a failure of discipline or willpower. It is your brain executing precisely the protective response it evolved to execute when fuel availability drops rapidly. It is doing exactly what it was designed to do. I want to tell you about a patient I will call Linda. 44 years old, an accountant, sharp and organized in the mornings, the kind of person who never needed to be reminded of anything twice. But every afternoon around 2 or 3 o'clock, she hit a wall that was completely predictable and completely defeating. Her thinking became foggy. She could not concentrate on the figures in front of her. And like clockwork, she would go to the vending machine and buy a chocolate bar. 4 years, Linda told herself the same story about this pattern, that she simply lacked the discipline other people seemed to have around sugar. She felt guilty. She tried to resist it. Sometimes she managed to, and by 4 o'clock the fog was so thick she could barely complete her work. What Linda was experiencing was a biochemical cycle that nobody had ever explained to her. Her lunch was producing a sharp glucose spike. A large insulin response was clearing that glucose rapidly. Her blood sugar was dropping below baseline. Her brain was detecting the drop and triggering an emergency craving response. The chocolate pushed glucose back up. Then it dropped again. By early evening, she felt completely depleted, not from the demands of her workday, which had been entirely ordinary, but from riding a blood sugar cycle 4 or 5 times since breakfast. Linda was not tired from working. She was tired from a metabolic pattern that had never been identified, named, or addressed. And here is the part of Linda's story that connects to the larger picture I need to describe. Every one of those insulin surges costs something. Every time the pancreas releases a large insulin response, it is performing a task that requires significant biological effort. Once, twice, 100 times, 1,000 times across years of daily meals. That cumulative demand begins to produce consequences. The cells that receive insulin signals start to become less responsive to them. The lock is present. The key is present. But the mechanism of the lock becomes increasingly stiff. The pancreas compensates by releasing more insulin to force the same outcome. More insulin required for the same result. This is insulin resistance, and it can progress silently for years, producing fatigue and cravings and abdominal fat accumulation and cognitive fog. While routine blood tests still return numbers that fall within technically normal ranges, I want to tell you about a patient I will call Michael. 52 years old, he came to see me about back pain that had nothing to do with blood sugar. But during the conversation, he mentioned something almost as an aside. For the past 3 years, he had been constantly hungry. He would finish a complete meal, and within an hour, the hunger would return. The sensation was so persistent that he had assumed it was simply how his body worked. His fasting glucose came back at the very upper boundary of the normal range. Not diabetic, not officially pre-diabetic by clinical definition, but a number of that position tells a specific story to a physician paying attention. The pancreas is approaching its compensatory limit. The reserve is narrowing. The next stage of this progression is prediabetes. After that, type 2 diabetes. After that, the cascade of complications that follow, years of sustained elevated glucose, damage to blood vessel walls, changes in vision, kidney stress, wounds that heal slowly or incompletely. This is not a theoretical future. This is what medicine encounters every week in patients who had years of warning signs that nobody connected to blood sugar until the numbers crossed a diagnostic threshold. The most important clinical insight here is this. The moment when nothing is officially wrong yet is the easiest possible moment to interrupt this progression, not when the diagnosis arrives now. And the most powerful tool for interrupting it is already built into your body. It has been there the entire time. Inside every muscle cell are structures called mitochondria. Their function is to take glucose from the bloodstream, combust it, and convert it into energy for movement and heat. When you are sitting still, those mitochondria are running at minimal output. They need almost no fuel. The moment a muscle begins to contract, glucose consumption accelerates dramatically. Here is the mechanism that changes the entire framework for understanding post-meal blood sugar management. Normally, glucose requires insulin to enter a cell. Insulin acts as a key that unlocks the cellular membrane, allowing glucose to move from the bloodstream into the tissue. But a contracting muscle has a second entry pathway that opens completely independently without insulin, without any involvement from the pancreas at all. When muscle cells are actively working, they activate a separate glucose transport mechanism that pulls glucose directly from the bloodstream through a pathway that bypasses insulin entirely. The pancreas does not need to be involved. The glucose moves from the blood into the working muscle through this alternative route because the muscle is demanding fuel and the body is delivering it directly. This is why the 90 minutes following a meal represent the most metabolically significant window of your entire day. That is when glucose from digestion is entering the bloodstream. That is precisely when your muscles can capture it directly, before it requires a large insulin response, before it gets routed to fat storage, before the blood sugar cycle builds the momentum that produces the crash. The question is, which muscles perform this function most efficiently? And the answer brings us to the muscle I described at the beginning. Behind your lower leg, below the knee, two muscles are stacked. The one you can see the visible shape of the calf is the gastrocnemius. Beneath it, deeper in the leg, invisible from the outside and impossible to isolate visually, is the soleus. You have almost certainly never consciously thought about your soleus. And yet, in terms of its capacity to pull glucose from the bloodstream through the insulin-independent transport pathway, no other muscle in the body approaches its efficiency per unit of effort. Researchers at the University of Houston published a study in iScience in 2022 examining a single specific seated movement performed after eating. Participants lifted and lowered their heels while keeping their toes pressed to the floor, not standing, not walking, sitting in a chair, heels rising and falling at a comfortable pace while the rest of the body remained still. Post-meal glucose spike dropped by approximately 52%. Insulin release dropped by nearly 60%. That second number is the one I want you to stay with for a moment. A 60% reduction in insulin release means the pancreas barely needed to engage. The soleus was pulling glucose from the bloodstream so efficiently through the insulin-independent pathway that a substantial insulin response was not required. The cycle never built momentum. The crash never followed. You can do this right now. Place both feet flat on the floor. Keep your toes pressed down. Lift your heels slowly and lower them back to the floor. Up and down at a comfortable pace without rushing. This movement can be performed at a desk, at a dinner table, on a couch, in a meeting, in a waiting room, in a car. As a passenger, nobody around, you will know you are doing it. And to 15 minutes of this movement after a meal produces measurable changes in post-meal glucose response. But Thessalus, while the most efficient single tool available, is not the only one. Any muscle activation in the 90 minutes following a meal engages the insulin-independent glucose uptake pathway. The more muscle tissue contracting, the more glucose your body clears without requiring a large insulin response. Here's what the research shows about the additional approaches. A 10-minute walk after eating. A study comparing two groups given identical meals found that the group who walked at an easy pace for 10 minutes afterward experienced a post-meal glucose peak, approximately half that of the group who remained seated. Not intense exercise, not an hour of sustained cardio, 10 minutes at a comfortable walking pace. The route is irrelevant. The direction does not matter. The movement is everything. Squats performed immediately after eating. The reason squats are particularly effective is anatomical. They engage the largest muscle groups in the body simultaneously, the quadriceps, the hamstrings, and the gluteal muscles. Larger muscle mass contracting means more glucose pulled from the bloodstream per minute of effort. 10 slow controlled squats after a meal, feet shoulder width apart, back straight, knees tracking over the toes, requires approximately 90 seconds and produces meaningful post-meal glucose reduction. Attaching this habit to something that already follows the meal, waiting for the kettle to boil for tea, walking to the kitchen sink, provides a behavioral anchor that does not depend on remembering. Household activity performed immediately after eating. This is the most underused tool on this list, specifically because most people already perform these activities. They simply perform them at the wrong time, washing dishes by hand, wiping counters, sweeping the floor, putting things away after the meal. 15 minutes of ordinary household activity produces glucose clearance roughly equivalent to a 10-minute walk. Your body is standing, moving, using muscle tissue. The glucose from that meal has somewhere productive to go immediately rather than being processed by a large insulin surge and partially routed to storage. The only variable is timing. Immediately after eating, while glucose is still entering the bloodstream from digestion, is when the insulin-independent pathway in your muscles can intercept it. An hour later, that window has closed. Now, let me connect all of this to the single underlying principle that makes these strategies coherent rather than a collection of unrelated tips. Blood sugar management is fundamentally a muscle availability problem, not a willpower problem, not a dietary purity problem, a problem of whether your muscles are contracting at the moment glucose is entering your bloodstream. When your muscles are actively working after a meal, they function as a glucose disposal system that operates independently of insulin, that does not require your pancreas to produce a large insulin surge, and that directly prevents the spike and crash cycle from reaching the amplitude that produces fatigue, cravings, and over years the progressive insulin resistance that precedes prediabetes and type 2 diabetes. Every post-meal movement session is in biological terms a direct intervention in that progression. Every time your muscles handle the glucose from a meal without requiring a large insulin response, your pancreas receives a break it would not otherwise have received accumulated across months and years. Those breaks are metabolically significant. They are part of the difference between a pancreas that remains functional and responsive into your 60s and 70s and one that has been pushed toward its compensatory limit by decades of insulin demand that movement could have reduced. Here is the practical framework beginning with your next meal. In the 15 to 20 minutes after you finish eating, choose one of the following based on what is available to you in that moment. If you can walk, walk for 10 minutes at a comfortable pace. If you cannot walk, perform 10 slow, controlled squats. If you cannot do either, sit and perform the soleus movement, toes pressed to the floor, heels rising and falling at a comfortable pace for 10 to 15 minutes. If none of those options are available, perform whatever household activity you are planning to do anyway, but do it immediately rather than waiting. Choose one. Do it consistently after every meal for 2 weeks. Not occasionally, not when you remember, consistently after every meal. The reason consistency matters more than intensity here is specific. The insulin-independent glucose uptake pathway in muscle tissue becomes more responsive with regular activation. A single post-meal movement session helps that one meal. A consistent pattern across weeks begins to shift how your entire metabolic system handles glucose. Insulin sensitivity improves. The post-meal spike decreases in amplitude. The crash becomes less severe. The cravings lose their urgency. Linda no longer walks to the vending machine at 3 Hulk in the afternoon, not because she developed more willpower because she understood the mechanism and changed one thing, what she does in the 15 minutes after lunch. The biology I have described today is operating in your body right now. The solus is there. The insulin-independent glucose transport pathway is there. The mitochondria in your muscle cells are there, ready to function, as the glucose disposal system they were designed to be. What they require is the signal to activate. That signal is movement, and it is yours to give immediately after your next meal. I want to give you one additional action that this information makes possible. At your next physician appointment, ask 2 specific questions that most patients never think to ask. Ask about your fasting insulin level, not only your fasting glucose. Fasting insulin reveals show hard your pancreas is working to maintain your current blood sugar numbers, information that fasting glucose alone does not provide. And ask about your hemoglobin A1C if you have not had it measured recently. This reflects your average blood sugar across the preceding 3 months and provides a picture that a single fasting measurement cannot. These questions, in the context of the mechanism I have described today, allow you to have a genuinely informed conversation about where you are in the progression I have outlined and what the appropriate level of intervention looks like for your specific situation. The most powerful blood sugar management tool available to you requires no prescription, no equipment, no gym membership, and no significant time investment. It requires understanding what is happening in your body in the 90 minutes after every meal and making one simple decision about what to do with that window. I am Dr. Kenji Sato. If this gave you a mechanistic understanding of your post-meal energy and cravings that your last medical appointment did not have time to provide, share it with someone who has been attributing their afternoon crash to aging or to having eaten too much without ever having the actual mechanism explained to them. The answer to the afternoon wall is not more discipline. It is understanding what your body is doing and giving it what it actually needs. All